Unspoken burdens. The silent struggle of nurses. They are the heartbeat of healthcare, the reassuring presence at the bedside. Nurses are the ones who hold our hands in the darkest moments and celebrate with us in times of joy. Yet behind their compassionate smiles, many nurses carry a hidden burden, the silent struggle of their own mental health. The weight of empathy, the constant exposure to suffering, and the relentless demands of the job can take a heavy toll. It's time to shine a light on this unspoken crisis and offer our support to these everyday heroes. Nurses are the backbone of the healthcare system, providing unwavering care to patients in their most vulnerable moments. They are the compassionate listeners, the skilled caregivers, and the unwavering advocates for those entrusted to them. But beneath the surface of their strength and resilience lies a hidden struggle. Nurses are increasingly facing mental health challenges, often silently bearing the weight of their experiences. If you found this video insightful, please like, share, and subscribe to the GM Health Passport channel to support our mission and stay informed. The weight of empathy. Emotional demands in nursing. Nursing is a profession built on empathy. Day after day, nurses immerse themselves in the lives of their patients, sharing in their joys, sorrows, and fears. They witness firsthand the fragility of life and the profound impact of illness. While empathy is a cornerstone of compassionate care, it can also be emotionally draining. Nurses absorb the pain and suffering of their patients, carrying it with them long after their shifts end. The emotional demands of nursing extend far beyond simply caring for physical needs. Nurses provide emotional support to patients and their families, helping them navigate difficult diagnoses, treatment decisions, and end-of-life care. They are present for moments of intense vulnerability, offering comfort and solace in the face of fear and uncertainty. This constant exposure to human suffering can leave nurses feeling emotionally depleted and susceptible to compassion fatigue. Inside the pressure cooker. Causes of mental strain. The pressure cooker environment of many healthcare settings further exacerbates the mental health challenges faced by nurses. Long hours, rotating shifts, and a constant sense of urgency create a breeding ground for stress and burnout. The high-stakes nature of their work, where lives hang in the balance, adds another layer of pressure. Nurses are constantly making critical decisions, often under immense time constraints, and the weight of these responsibilities can be overwhelming. Beyond the demanding work environment, nurses often face a lack of support and resources to address their mental health needs. The stigma surrounding mental health in healthcare persists, making it challenging for nurses to seek help without fear of judgment or repercussions. The shortage of mental health professionals further limits access to care, leaving many nurses feeling isolated and alone in their struggles.
I love being a nurse, but some days I go home feeling like I've left a piece of myself at the hospital. You witness so much pain and suffering, and it's hard not to carry that weight with you.
Sarah's story resonates with countless nurses who struggle to reconcile the emotional demands of their profession with their own well-being.
The constant adrenaline rush takes its toll. You're always on high alert, dealing with life or death situations. It's hard to wind down after a shift, and I often find myself replaying those intense moments in my head.
John's experience highlights the cumulative impact of stress on nurses, leading to anxiety, insomnia, and other mental health challenges. The mental health of nurses is not just a personal issue. It has far-reaching consequences that extend beyond the hospital walls. When nurses are struggling, their well-being is compromised, potentially impacting the quality of care they provide. Burnout, compassion fatigue, and other mental health challenges can lead to decreased job satisfaction, increased medical errors, and a decline in patient safety.
The ripple effect of poor mental health among nurses also reaches into their personal lives. The emotional exhaustion and stress they carry home can strain relationships with family and friends. Nurses may withdraw from social activities, experience changes in their mood and sleep patterns, and find it challenging to engage in self-care practices. The well-being of nurses is inextricably linked to the health of our healthcare system and the communities they serve.
It's time to prioritize the mental health of our nursing workforce. Hospitals and healthcare organizations must create a culture that values and supports the well-being of their staff. This includes providing access to confidential mental health services, implementing stress reduction programs, and fostering a workplace environment that promotes work-life balance and peer support.
We can all play a role in supporting the mental health of nurses. Let's treat these compassionate caregivers with the same kindness and respect they show their patients. A simple thank you, a listening ear, or advocating for better working conditions can make a world of difference.
By raising awareness about the challenges nurses face and promoting mental health resources, we can help create a healthcare system that values the well-being of both patients and providers.